special counsel for the Interstate Commerce Committee is enlisted to investigate allegations of conspiracy on the part of the medical establishment. In 1953, Fitzgerald's report is submitted to the United States Senate, stating, "My investigation to date should convince this committee that a conspiracy does exist. Public and private funds have been thrown around like confetti at a county fair to close up and destroy clinics, hospitals, and scientific research labs which do not conform to the viewpoint of medical associations." The report is buried, Fitzgerald reassigned, and today the battle to suppress innovation rages on.
Canadian research team has come up with DCA. They believe it's a cheap and simple drug that kills almost all cancers. You heard that right. The real story is, you can't have it. Not because it's unsafe, but because your blood's going to shoot out of your eyes, because it doesn't make any money.
DCA isn't owned by any pharmaceutical company. There's no patent on it. So on one hand, it could become a very inexpensive new treatment for cancer. On the other, drug companies won't be interested in funding studies for a drug that won't make them a profit.
And in the U.S., the FDA has shut down all sites selling the drug.
How do you take something that costs pennies a day and fit it into a system that at the end of the process is supposed to generate a drug that's going to make $2 or $4 billion a year for you? Can't be done.
Back in the early to mid 80s, I was in the laboratory and we worked on an immune therapy, and I thought this would be very applicable for children with bone cancer that spreads to the lungs.
Because the cancer Dr. Kleinerman is investigating only affects 1,000 children a year, no pharmaceutical company will finance the trials necessary to get FDA approval. But through a grant, the trials are designed and funded. The results are remarkable, and a breakthrough cure seems imminent.
Well, the FDA, in looking at the design, said, we don't like the design, and we don't think it should have been designed this way. But, okay, we did it, and the data's there, and the data's been submitted for publications to one of the top oncology journals. But it doesn't look like it's going to be accepted as the pivotal trial to get licensing. This is children's lives. As we argue back and forth between what should be done, our patients are losing valuable time that they don't have.